All right. What do you think is the #1 risk factor for dementia? Well, not the risk factor. What's the #1 sign of dementia? Let's see. That's not right. All right, let's see. Let's try again. Okay. Difficulty remembering new learned information. Okay, so don't scream this out, but ask yourself, what is the rate of dementia among 65-plus-year-olds? Don't scream it out, ask yourself. If you remember, that's a good sign, means you probably don't have dementia. If you already forgot, I'd be a little bit concerned, okay? Now you can all scream it out. What was it? 1 in 8. Uh-oh. Now, just because you got it wrong, okay? I've forgotten what time it is, 9 o'clock meeting tomorrow, okay? So don't, just because you got that one question wrong, suddenly decide, oh my God, I've got dementia. Because as we discussed in the first lecture, just because you think it doesn't make it so. Thoughts are not facts. Thoughts are not facts. So just because you think you have dementia doesn't mean that you have it. In fact, if you're at the level where you're thinking that you have it, you're probably not in denial and you probably don't have it. So as this guy here is thinking, I can't remember what time my 9 o'clock meeting is, people can work themselves up into believing anything. All right. First of all, is it even dementia? Okay, everybody talks about dementia. Is it always dementia? Well, this is a chart that shows there's a lot of other things. It's called the differential diagnosis, okay? Doctors see a patient come in, we generate what's called a differential diagnosis. We look at all the different possibilities. And as you can see on this list, there's a lot of different possibilities for things that can be disguised as dementia. And a good doctor will look at these different things and try to eliminate them. You don't need to memorize this. I will not quiz you on this particular list, okay? Moving right along. First of all, there's something called delirium, okay, which is not dementia. And I'm going to put up a table. It's not a great table. It's a little bit fuzzy. But the key things here that I want to focus on is that the onset of dementia is insidious. It's kind of slow. But delirium comes on fast. So if suddenly you don't remember anything, it's probably not dementia, okay? It's probably got something else going on. And delirium can be fluctuating while dementia is stable and progressive. And duration of delirium is hours to days, while dementia is months to years. And psychomotor, which means your ability to control what you're doing. In delirium, it's increased, it's decreased, it's unpredictable. And in dementia is your arms are not flailing around like they might be in delirium. So it's just important to realize that, and in delirium, you have a disrupted or reversed sundowning, the sleep-wake cycle. While in dementia, it's very fragmented. So just a couple of things to understand, that just because you have some symptoms of memory and whatnot, it isn't necessarily dementia. And that's a very important fact. Okay. Now, are there different types of dementia? Anybody? Yes. Anybody know some types? We all know Alzheimer's. What else? No, senile just means they associate it with getting old, which, by the way, we'll find out is a myth. You don't get dementia simply because you get old. What? No, that's not dementia. That's a different neurological condition. Anyway, so there are different types of dementia. Absolutely. Let's look at a few of them, and let's try to understand them. All right, so here's a pie chart showing different types. So of dementia, only 62% are actually associated with Alzheimer's. 17% are vascular dementia, 10% are mixed, and then you got a couple of strange different other ones. I won't go into that. It's very technical. But the point of the matter is, realize that, again, 38% of dementia is not Alzheimer's, okay? You can focus on the negative that 62% is, but 38% is not. And that's particularly important because you've got 27% related to vascular damage. And who remembers the name of this lecture? Uh-oh. The relationship between lifestyle and dementia. And there's a very, very strong correlation between lifestyle and vascular damage. Let's try to get into it. First of all, this is a CT scan of vascular damage. You see the white areas? Okay. The white areas are parts of the brain that were cut off from blood and died. That's what happens in vascular dementia. It's like a heart attack of the brain. The brain doesn't get blood supply, and those parts of the brain begin to die, okay? As opposed to in Alzheimer's, okay? The left side is normal. On the right side, you see in Alzheimer's, it's not that the brain is dying, it's shrinking. Okay, and so, by the way, the diagnosis of Alzheimer's historically was only made on autopsy. So many people, particularly among Orthodox Jews who do not allow autopsy, the diagnosis of Alzheimer's could never be made. My own father was suspected to have some form of dementia. It wasn't clear, but we suspected it was not Alzheimer's, but it was a vascular dementia. He had been a smoker, he was overweight, he had some diabetes, i.e., he didn't take particularly good care of himself. I don't remember him exercising the last 30 years of my life. So all those factors contributed to, one, he developed prostate cancer, he ended up having a stroke, and unfortunately, all of a sudden, he passed away. Okay, so let's look at a comparison between vascular dementia and Alzheimer's. Alzheimer's is gradual, vascular dementia could be sudden or gradual, okay? The progression, one is progressive decline of memory, the other one is slow decline. Memory, early pronounced deficit, mild impairment. Now this is an important one, executive dysfunction. Late appearance in Alzheimer's. Now, does anybody know what executive function is? Yeah. Decision-making ability. Decision-making ability. This is very important because in vascular dementia, you have an early pronounced loss of decision-making ability. While in Alzheimer's, it's not about decisions, it's about memory, okay? And the other key one is cardiovascular history. In Alzheimer's, it's less common, not uncommon, but less common to have a cardiovascular history, something related to your heart, while in vascular dementia, you might have had what's called a TIA, a transient ischemic attack, when suddenly you get black in one or two eyes. You might have had a cerebral vascular accident, i.e. a stroke, or you might have other vascular risk factors, like they may find that some of your arteries are clogged. So again, very important to understand between the two. Now, vascular dementia is also called multi-infarct dementia because one little infarct in and of itself isn't going to destroy all that memory you've accumulated over those 60, 70, 50, 80 years. You need lots of little infarcts, and quite frankly, once you're cutting off blood supply from one artery, it's likely that other arteries are also clogged and you're going to continue to cut off blood supply. So that's why it's called multi-infarct. The word infarct means cut off blood supply and to have that cell tissue die. Let's look a little bit closely at what's happening there. A stroke is an interruption or blockage of the blood supply to any part of the brain, the same as a heart attack. Remember what, does anybody remember the famous protect your head. Right. You got the same vascular system. When you're talking about arterial sclerosis, hardening of the arteries, okay? If you're hardening the arteries leading to the brain, you're hardening the arteries leading someplace else. That's why diabetics have a lot of problem in three particular areas where there are very small blood vessels, and so they close off quicker than other parts. Anybody know the three areas that diabetics have particular problems with? Feet, because we have very small blood vessels in the feet. Eyes, very small blood vessels. Was that delirium or dementia? Yes. And kidneys. That's why you get diabetic retinopathy, diabetic nephropathy, and diabetic peripheral vascular disease. Okay. So next, multi-infarct means that many areas in the brain have been injured. When these strokes affect a small area, there may be no symptoms. No symptoms. These are often called silent strokes. In fact, in the last week, I saw two patients whose EKG suggested they had had heart attacks, and they did not know it. So just like you can have silent strokes, you can have silent heart attacks and not know it. And finally, over time, as more areas of the brain are damaged, the symptoms of multi-infarct dementia begin to emerge. Okay, study out of Columbia University and the Taub Institute. Memory after silent stroke, hippocampus and infarcts both matter, okay? Just confirming what I just told you, this study just came out, last week that these strokes to the brain are causing vascular dementia. Risk factors for dementia. Diabetes. Logical, right? Clogging of the arteries, accelerating arterial sclerosis, obviously contributing to vascular dementia. And again, you can have Alzheimer's and vascular dementia overlapping. So you could have a dementia from Alzheimer's and it could be sped up because you're also, unfortunately killing parts of your brain from poor circulation. Hardening of the arteries, again, atherosclerosis. High blood pressure, and this is going to be very important. We're going to see in the slide in a few minutes the correlation between high blood pressure and dementia. And in fact, amazingly, I haven't seen a lot of studies on this, and I'm very surprised because there's a very strong correlation. And finally, smoking and stroke. Obviously, stroke, for the obvious reasons, mini strokes, big strokes, it's not helping. Yes?
How about genetics?
So there's a genetic predisposition to Alzheimer's. We know it does run in the families, but these are the factors that are contributing above and beyond. Now, you could have a genetic predisposition to everything on this list. So in a certain way, these things lead to it, as do some genetic predisposition. And we'll talk a little bit later about apolipoprotein E, which is strongly correlated to diabetes and Alzheimer's. It's a particular protein that they have found that is associated with both diseases, so there seems to be some connection, but they have not yet made the definitive connection. Okay, Alzheimer's patients and the percentage of coexisting conditions. Quite frankly, this was startling to me. I got this out of the Alzheimer's Foundation literature. Hypertension, 60%. 60% of Alzheimer's patients have elevated blood pressure. One more reason to be very aggressive in treating high blood pressure. Coronary heart disease, 26%. Stroke, 25%. Diabetes, 23%. Osteoporosis, 18%. And cancer, 13%. The one, again, that stands out on this list, folks, is hypertension, high blood pressure. So let's get serious about treating our high blood pressure. All right, the School of Medicine, New York University. Yay, my alma mater. Okay, long time ago, almost 30 years ago. Obesity associated with increased cognitive impairment due to lower brain blood volume. Being heavy decreases your blood flow. Decreasing your blood flow is not good for your brain. So obesity also, yet another reason to get into an obesity reduction program. Archives of General Psychiatry, just another study that just came out. Type 2 diabetes plus depression doubles the risk for dementia. Another reason to see a psychologist if you are depressed, because quite frankly, most depression is not the organic type. In other words, it's not something wrong with your brain. It's just that you're overwhelmed by stress or family events. Somebody told me yesterday she has her grandchildren who are heroin addicts living at the house, and that's causing stress for her. Well, okay. So it doubles the risk for dementia. Okay. Body clock might affect women's dementia risk. Another study that just came out, notice the word might, and this is the trick in all studies. When you see the word might, it means it's an observation study. It's not a definitive study. But in this study, they seem to indicate that people who oversleep, we know sleep is important, but if you're waking up 10 o'clock in the morning and you're not getting going till noon, okay, no good. No good. You know, Benjamin Franklin, early bird catches the worm type of thing, you know, some truth to that. Old Benjamin Franklin, ounce of prevention is worth a pound of cure. He was onto something, folks. Smart guy, he knew. And sleep too much, do too little, and you're going to have problems. So while sleep is important, that's not an excuse for staying in bed 10, 11 hours a day. It's not healthy, not healthy.